this short video, you are going to learn about Anna Freud, who created the field of child psychoanalysis and contributed significantly to our understanding of child psychology. We are also going to understand 9 of Anna's ego defense mechanisms. This video contains 3 sections. First, a short biography of Anna Freud, second, defense mechanisms, and third, child psychoanalysis. If you get some value at any point in this video, please consider subscribing and don't forget to like the video so you help the channel out. Let's dive into it. Anna Freud, 1895 to 1982. Think about the kids. Anna Freud was born on December 3, 1895, in Vienna, Austria, and was the youngest of Sigmund Freud's 6 children. Though she felt distant with her siblings and mother, Anna was very close with her father. While she did attend a private school, she claimed to have learned very little in class and that much of her education came from being around her father's friends and associates. Following high school, Freud began translating her father's work into German and working as an elementary school teacher, where she began to take an interest in child therapy. In 1918, Anna contracted tuberculosis and had to leave her teaching position. During this trying time, she began giving her father accounts of her dreams. As he began to analyze her, Anna quickly cemented her interest in her father's profession and decided to pursue psychoanalysis on her own. Although Anna Freud believed in many of the basic ideas that her father did, she was less interested in the structure of the subconscious and more interested in the ego and the dynamics, or motivations, of one's psyche. This interest led to the publication of her groundbreaking book, The Ego and Mechanisms of Defense, in 1936. Anna Freud is perhaps best known for creating the field of child psychoanalysis, which provided great insight into child psychology. She is also recognized for developing different methods to treat children. In 1923, without ever earning a college degree, Freud began her own children's psychoanalytic practice in Vienna and was named as the chair of the Vienna Psychoanalytic Society. In 1938, Anna Freud and her family fled the country and moved to England as a result of the Nazi invasion. In 1941, she founded an institution in London with Dorothy Burlingame and Helen Ross called the Hampstead War Nursery, which served as a foster home and psychoanalytic program for homeless children. Her work with the nursery led to 3 books, Young Children in Wartime in 1942, and Both Infants Without Families and War and Children in 1943. In 1945, the nursery closed down and Anna Freud created and served as director of the Hampstead Child Therapy Course and Clinic, a role she maintained until her death. By the time she passed away in 1982, Anna had left a lasting and deep legacy on the field that was possibly only overshadowed by the monumental impact of her father and a handful of other psychologists. Defense mechanisms. To understand Anna Freud's contributions to the notion of defense mechanisms, we must first take a look at the work of her father. Sigmund Freud described certain defense mechanisms the ego uses when dealing with conflicts with the id and superego. He claimed that a reduction of tension is a major drive for most people, and that this tension was largely caused by anxiety. Furthermore, he broke anxiety up into 3 types. 1. Reality anxiety, the fear of real-world events occurring. For example, a person is afraid of being bitten by a dog because they are near a ferocious dog. The easiest way to reduce the tension of reality anxiety is to remove oneself from the situation. 2. Neurotic anxiety, the unconscious fear that we will be overpowered by and lose control of the urges of the id, and that this will lead to punishment. 3. Moral anxiety, the fear of our moral principles and values being violated, resulting in feelings of shame or guilt. This type of anxiety comes from the superego. When anxiety occurs, Sigmund Freud claimed that defense mechanisms are used to cope with the anxiety and shield the ego from reality, the id, and the superego. He said that oftentimes these mechanisms unconsciously distort reality and can be overused by a person to avoid a problem. It can therefore be beneficial to understand and uncover these defense mechanisms so that a person may manage their anxiety in a healthier way. But where does Anna Freud come into play? Most notably, she is responsible for identifying the specific defense mechanisms that the ego uses to reduce tension. They are denial, refusing to admit or recognize that something is occurring or has occurred. Displacement, taking one's feelings and frustrations out on something or someone else that is less threatening. Intellectualization, thinking about something from a cold and objective perspective so that you can avoid focusing on the stressful and emotional part of the situation. Projection, taking your own uncomfortable feelings and attaching them to someone else so it seems as though that person is feeling that way in place of you. Rationalization, while avoiding the actual reason for a feeling or behavior, a person will create credible, but false, justifications. Reaction formation, behaving in the opposite way to hide one's true feelings. Regression, reverting back to childlike behavior. Anna Freud claimed that a person would act out certain behaviors based on the stage of psychosexual development that they were fixated on. For example, a person stuck in the oral stage might begin to eat or smoke excessively, or become more verbally aggressive. Repression, moving thoughts that make us uncomfortable into our subconscious. Sublimation, converting unacceptable behaviors into a more acceptable form. For example, a person with rage takes up boxing as a way to vent. Sublimation, Freud believed, was a sign of maturity. Child psychoanalysis. To create a successful therapy for children, Anna Freud originally planned on using her father's work as a guide, so that she could make a timeline and map out a normal rate of growth and development for children. That way, if certain developments, such as hygiene, for example, had been missing or lagging, a therapist could pinpoint the cause to a specific trauma and could then use therapy to address it. However, Anna quickly came to realize that there were major differences between children and the adult patients her father had seen, and her techniques had to continually change. Whereas Sigmund Freud's patients were self-reliant adults, Anna Freud dealt with children, for whom a major part of their lives involved the presence of their parents. Freud saw the importance of the parents early on. Still, a major aspect of child therapy includes parents taking on an active role in the therapy process. For example, parents are generally informed of exactly what goes on during therapy so that they are able to apply the techniques from therapy in everyday life. Anna Freud also saw the usefulness that child's play could have in therapy. Children could use playing as a means to adapt their reality or confront their problems, and could speak freely during therapy. While play may help a therapist identify a child's trauma and treat it, it doesn't reveal much from the unconscious mind because unlike adults, children have not learned to cover up and repress events and emotions. When a child says something, they mean it. While she may have begun her career under her father's shadow, Anna Freud proved that she too was an incredibly valuable asset to the world of psychology. Her contributions to her father's work on defense mechanisms and, most importantly, the creation of child psychoanalysis remain extremely important and influential, and a great deal of what we understand about child psychology comes from her work.